Hello, and welcome to our presentation on the prevalence of PTSD in female Iraqi refugees living in Australia. Hi, Atara. Could you tell me a bit about how your background influences your health?
As an Iraqi refugee, there are many different ways that my health is affected. One of the main ways is my condition of PTSD. It affects my mental health tremendously. PTSD affects my mental health and well being, as it affects my ability to work in certain environments. I am unable to work in environments that are high stress as they will bring back the past trauma I have lived. As a result of living in this country under refugee status, my qualifications are not awarded as they were in Iraq. I am unable to apply for jobs that I otherwise would be qualified for. This results in me having to work at the factory, which are long hours standing on my feet. This affects me as it has caused health issues such as standing on my feet all day causes my feet to be blistered and a lot of pain in my back. Socially, I struggle with trying to communicate with others due to my poor English, and the language barrier affects me a lot as I feel socially isolated and alone. A major cultural difference in living and working in Australia versus in Iraq is that I have to work side by side with men, which otherwise I wouldn't be doing in Iraq. This has caused me to feel uncomfortable at work. Spiritually, I feel as though I'm unable to connect with my religion, as I do not have places of worship and religious communities that I'm close to, as I do in Iraq.
Do you think there are any risk factors that contribute to the health of other people like yourself?
There have been some risk factors that I know of which have an effect on the health status of Iraqi people. A main one, which I also suffer from, is post traumatic stress disorder. I found members of the Iraqi community here in Australia have felt the effect of PTSD through losing family members in uncommon ways because of war. There have been Australian Iraqi refugees who have said that they were close to dying, and also others stated that they had a low deficiency of nourishments and water. I too have had similar events happen to me and my daughter on our journey to Australia. I think these events would have a major impact on the health conditions of Iraqi refugees. Another risk factor that affects the health of Iraqi refugees is their lack of knowledge for mental health literacy, where they know and understand about mental disorders such as PTSD. As an Iraqi refugee such as myself, I did not know or understand any English when I first arrived, so it was very difficult for me to know about mental health disorders. Not knowing about any mental health literacy can have a significant effect on the health status of Iraqi refugees here in Australia.
Have you encountered any modifiable or non modifiable risk factors that contribute to the health of people like yourself?
As an Iraqi refugee, I have found many risk factors that fall under the bracket of non modifiable and modifiable, which all contribute to provoking PTSD in refugees from Iraq. Refugees with family members still in Iraq have greater tendencies to develop symptoms of PTSD and other mental health illnesses such as depression. Leaving behind my husband and fleeing the country with my daughter has strained my health and has enhanced my PTSD. Such risk factors are non modifiable as seeking refuge in another country is a complicated process. However, may be considered modifiable once my husband is able to leave the country and move to Australia with us. Most refugees, including myself, arrive in Australia after experiencing trauma, mainly the Iraq War. This is considered a non-modifiable risk factor that heavily impacts our PTSD. Our health is further diminished through the non-modifiable risk factors, including experiencing a traumatic event at a younger age, our gender, as females tend to have a heightened chance of having symptoms of PTSD, and the place of our birth. Risk factors such as having poor social support and lacking the understanding of the certain treatment options available are the modifiable factors that influence the development of PTSD. These factors are modifiable as they can be altered and changed to better cater a refugee's needs. The modifiable and non-modifiable risk factors play a key role in impacting the mental health status of many Iraqi refugees.
What are some things that have helped you access healthcare services in Australia?
When I first arrived in Australia, I was introduced to the Integrated Humanitarian Settlement Strategy, which offers help to new refugees for the first 6 months of their arrival in Australia. I had access to different services such as job network organisations that helped me gain employment in a factory. I was also offered help to find accommodation, and I have been living in the public housing towers in Footscray with my daughter. Finding a job and a place to live was very important to me because this allowed me to gain some financial and housing security first before addressing the health needs of myself and my daughter. We had a needs assessment after meeting up with a social worker, and she created a case coordination plan specifically for our needs. She was then able to provide referral and information to other health services for trauma and counselling, where I was diagnosed with PTSD. My daughter and I were also able to access health allowances, such as Medicare and a healthcare card. That helps with purchasing medicine at a reduced cost. I have found this to be financially beneficial as I take medication for my anxiety. Having subsidized healthcare also allows me to take my daughter to regular health checkups and ensures that she has been immunized properly, which was something I was not able to do back at home.
What are some barriers you have faced in accessing healthcare services in Australia?
As a Muslim woman coming from a strict culture where I have many responsibilities and duties that must be met, I struggle accessing healthcare services. During the conflict in Iraq, many of us refugees had interrupted educational opportunities, which is the main reason I have difficulty when reaching out for help regarding my PTSD. Despite being a college professor, I cannot speak fluently in English. Therefore, the lack of understanding of the risk factors, symptoms, and treatment associated with the mental illness PTSD that I have been diagnosed with is a barrier when accessing healthcare services. Often, us Iraqi women would center our needs and feelings to a doctor, as we have difficulty in describing due to the language barrier and our religious beliefs. When complaining or discussing my trauma, I feel as though I might be going against God's will. Another barrier that impacts mental health care uptake for me includes the mental illness stigma in our culture. Coming from a Middle Eastern background, it is viewed as a burden to the family of one diagnosed with a mental illness, as well as a mark of shame. Iraqi women, including myself, fear being labelled mentally ill, as well as I fear losing my daughter to authorities. I also find it troubling to communicate with healthcare services, whether regarding mental illness or lifestyle decisions, due to the differing views of mental health and well-being. For example, I am strongly attached to the advice of my elderly and their lifestyle. However, when isolated away from family, I feel concerned and stressed when I receive contradictory advice from health professionals, which makes me lose confidence in my traditional mothering role.
What do you think should be done to help Iraqi women like yourself access healthcare more effectively?
This is a tough question because there are a lot of different layers that impact our overall access to health services that have to do with our social status in our society. This means recognizing that there are many social determinants that interfere with our accessibility to healthcare, and addressing these factors is important. An example is that many of the qualifications we have achieved are not translated here in Australia. This impacts our level of employability and financial status. If we don't have money, we are less likely to use specialist services, such as seeing a psychologist for PTSD. Educating health professionals on Iraqi culture and religion will help the Iraqi community build trust and therefore increase use of health services. Things such as preferring to see a female practitioner is an important aspect of Muslim culture, and therefore affects individuals wanting to access healthcare services. Educating health professionals on cultural competency will therefore bridge communication between Iraqi women and allied health practitioners. Cultural competency will also help in decreasing stigma and discrimination against the refugee community. This will increase the utilization of healthcare services because the individual will feel accepted and respected.
Studies have demonstrated that female Iraqi women suffer from particularly high rates of PTSD from traumatic events pre-arrival to Australia. Symptoms of PTSD may be exacerbated and poorly managed during resettlement from factors such as social isolation, language and communication restraints, and lack of knowledge surrounding mental health disorders and treatment options. This results in a negative impact on all dimensions of health. Although there are services in place directed at helping refugees, the delivery and access of these services are very poor and limited. Enhancing cultural competence in the health system is of the utmost importance to help integrate female Iraqi refugees into the Australian community and to decrease rates of PTSD. To conclude our presentation, we would like to highlight that there are many overlapping inequalities that female Iraqi refugees face in Australia that make it harder for them to overcome PTSD. Much more awareness needs to be raised to address these inequalities. Thank you for listening.